Hi, my name is Connor. Welcome to this short video, where you will learn about governance for quality improvement. So, what does governance in healthcare mean for everyone? Let's take a look. Many of you will have heard of the term clinical governance. This means that there is a systematic approach through which healthcare teams are accountable for maintaining and improving the quality and safety of care they provide. Improving quality starts with governance. Let's see what governance for quality improvement looks like in practice. Governance for quality improvement is about using the structures, processes, standards, oversight, and accountability for delivering and sustaining quality improvement. Let's take a look at what these structures might look like when planning an improvement initiative. Firstly, you will need to set up your team. It's important to define team roles and responsibilities and assess your team's readiness for improvement. Ensure you have a project sponsor who can provide advice and support your improvement initiative. Try to align improvement aims to your department or organizational goals. And finally, develop a communication plan to ensure you keep everyone, including your project sponsor, up to date on the progress of your project. Good governance structures will support you when planning to undertake your improvement project. These supports will help you succeed, sustain, and even spread your improvement to other areas. If you are thinking of starting a quality improvement in your area of work, here are some simple steps to help guide you along the way. Let's start by looking at how to set up your quality improvement team. Wherever you are working, if it is a GP surgery, primary care center, or hospital, start by making sure your team includes the people from all the areas of the service or the people involved in the care pathway who will be affected by your proposed change. These may include a nurse, a doctor, an allied health professional, an administrator, a porter, a healthcare assistant. Make sure you don't forget to include a patient representative on your team where possible.
Patients, families, and service users have a unique insight into how the service is working for them.
We can share our experiences of what has worked or what has not worked for us in the past. Including our voice helps to inform the present and influence the future of healthcare, so why not do this together?
Having talked about who might be in our team, we will now look at the next steps we need to take to start our improvement journey. Hopefully, you have been able to include a patient or capture the patient's voice. Now you will need to identify who will provide day-to-day leadership of your improvement team. A good team leader will work closely with the team to agree how they will keep connected and agree on ways they will work together. The team lead will link, on the team's behalf, with the project sponsor and keep them up to date on the progress of the improvement initiative.
It is important to identify a project sponsor who will support your team. The project sponsor will help you to liaise with key stakeholders, share your work with the senior management team, and help you align your improvement to department or organizational goals. This support may come from your line manager, your quality and patient safety lead, director of nursing, CEO, community healthcare lead, or other service leads. Your local improvement facilitator or quality improvement champion can also provide valuable support to your team on your quality improvement journey.
The next step is to agree team roles and establish when the team will be ready to start the improvement project. It is important to spend some time planning your improvement initiative. Your sponsor will need to know when you propose to start and finish your project, why you want to do this improvement, and what benefits the improvement might bring. Next, we need to agree on an area of practice that we want to improve. It's important that we choose something that we all care about. Before we start, it is useful to find out if there are other teams who have completed an improvement project in your area. They might be willing to support you and share their lived experience of quality improvement in practice. Finally, choose one small area in your local service or a care pathway that is within your control to improve. Let's summarize the key governance structures and processes you need to have in place to ensure your team is ready to start your improvement journey. Once you have set up your team, you will need to clarify roles and responsibilities. You will need to identify a team sponsor who will support your improvement project and let them know when you will start and how long the project will take. You will need to agree on how your team will communicate your progress. Finally, once you have a small improvement that is within your control to change, you are ready to start improving. Wishing you the best of luck with your quality improvement initiatives. Most of all, enjoy your journey.